Here are the 5 major hormonal events every woman goes through. Save this video and send it to every woman and girl that you know so that we can spread better education about our bodies. You know what? Send it to all the men. They need to know. All of these events are centered around ovulation. If you've watched my videos before about hormones, our health as a woman is centered around our ovulation. First event, we have pre-puberty. We're not cycling yet. Your brain is not talking to your ovaries, so hormones are quiet. This is pre-puberty, and the ages are birth to around 8, 10, 12, whenever puberty starts. Puberty can happen around age 8 until 13, 14, 15, 16. This is when your hormonal cycle turns on. This is when your brain starts talking to your ovaries. Your estrogen starts to rise, so your body starts looking different. But progesterone is still inconsistent, and a lot of parents sometimes freak out because inconsistent progesterone, which means that you can have irregular periods, and it's very normal to have irregular periods for the first year of having periods. Once progesterone starts to stabilize, then you'll start seeing a regular hormonal cycle unless there is some type of ovulation dysregulation. Then you enter something called premenopause. So these are all of your reproductive years post-puberty up until perimenopause. So this is going to be, roughly around your late teens all the way up until you start perimenopause, when ovulation starts to weaken, all the way up until, age 35, late 30s, 40. These are the good years. These are when your infradian cycle is nice and regulated. Estrogen, progesterone, testosterone, they all rise and fall in a pretty similar pattern every single month, unless there's some kind of disruption going on from your nervous system or other factors. Then comes perimenopause. So this can happen around age 35, and it happens all the way until menopause. Ovulation becomes inconsistent, meaning progesterone starts becoming inconsistent. Your hormones start to fluctuate. That nice infradian rhythm is no longer pretty similar every single month, because sometimes you ovulate, sometimes you don't. This is your brain really struggling to communicate with your ovaries. Then you hit menopause, which is the realization of 12 full consecutive months without a period. That means you haven't ovulated for 12 months straight. That means your brain is no longer communicating with your ovaries to tell them to ovulate. So all hormones start to settle and have now reached a low